What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering how hard is it to be an X-ray tech at a hospital, emergency room, I guess you would say. So to give you context and my credentials, I am a night shift tech. Been doing it for 4 years. Work a lot of overtime, so I do dabble with the day shift. So, if you want to do it, the X-ray or nurses or whatever, so as far as difficulty goes, this is just based off of, because my family and my lady, we have many people in different areas of the medical field. So I would say in the shortest term, X-ray would be kind of at the lower end of more of a difficult. It do have situational where you're both, it is dangerous as far as like there's radiation involved and like patients are always in pain. There's those. But as far as how hard in the overall world of medical wise, just plain X-ray here, we're talking, would be pretty low. Like it would be not that hard. I ain't saying that anyone can do it because it's not for everyone. And we're not saying that nurses should do our jobs. It's not like that. My lady's a nurse, and I've seen what she does, and I've seen what they do at the hospital, and the amount of stress, which ours is stress, situational stress. They're constantly stressed. I am stress-free. I will say that. But as far as how hard it is, I wouldn't say it's that hard. I mean, I say that because, I've been in the game for long. Majority of the time we do chest x-rays, 30 seconds if it's a one view in and out. Compared to if you were a nurse, that's your patient. You got to know all the history, all the report. Like there's so much other stuff, even PTs, even doctors, like all the others, like a lot of them that I've constantly, when it gets slow, they'll sit there and we'll talk with like nurses, respiratory. They're like looking at us and they're like, damn, I really wish I would have went into X-ray because I be seeing what y'all do. And it's like this a good work-life balance. And I'm like, yeah, it is sometimes. Because like let's say for someone who does respiratory, right? A lot of the times, usually where respiratory is, we will follow because people can't breathe. And if they can't breathe, they need a chest x-ray. But the problem is, respiratory, got to do breathing treatment, got to intubate, got to do a bunch of things, and people constantly change. There's a lot of stuff. Versus us, we'll go there, shoot it, and then we'll leave. If he gets worse, we might come back. That's about it. Literally, that would be it. Same thing with like if someone's in the trauma room, let's say their leg's broken or they're sticking out. They're like, okay, boop, boop, shoot our picture, a few minutes, doctor looks at it. Oh, dang it, it's broken. I'll call y'all back when we do like for what's called post-op. Like post-operation, like they'll like place it back in place and then we'll shoot it again. There's times where we'll like sit there and wait for them to like try to get it back in place, and then we'll take them, the nurses, doctors, every respiratory, because sometimes they got to put them to sleep to pop it back in place. They'll be doing a lot of work, and it's until all that stuff gets done or they try to do it the best that they can. Then we come in at the very end, take the shot, and they look at it like, okay, good, bye. Like it's literally can be that easy. I would highly recommend our job to anyone who, like, we don't deal that much with patient care. Any major questions asked by the patients, usually we're like, let me ask your doctor, let me ask your nurse, because we really don't go too in depth. Unless you're in the main, then the main radiology, you would go a little bit more in depth into researching your patients because they'll have more procedures and stuff done. That's a little bit different. But like in the ER, unless I see you all the time, I kind of have a brief history on why you're here and you're notorious. Like, there's certain patients that will come in, as soon as their name in, I'm like, you're going to get a chest x-ray because you probably missed dialysis. Or you're going to get this because of this. Like, there's certain stuff like that. So there's that dynamic. And I mean, if you don't like blood and bones and people crying and people like, then I could see how you would not enjoy our profession, because you don't get x-rays if you're not good. So it's a little bit different. And we don't get really the benefit of, people really don't like us because we make a move while they hurt to be able to diagnose them. Like, well, to be able to get the optimal pictures and stuff. So people aren't always the best with us. But we do play a vital role in helping people. We don't always get the recognition. Even on Rad Tech Week, you still won't get much compared to the nurses and doctors are up here, which they do. I will give them, I will always salute my hat off, because it couldn't be me. Same thing with my ladies, who's a nurse. I will always tell her, I couldn't do it. You couldn't pay me more money to do it. I respect you for doing it, and that's your thing. I appreciate it, because it's not for me. Even physical therapy, even respiratory, even all the other health, I respect y'all. Y'all have my utmost respect, because I couldn't do it. Because like the level of liability to, as far as like, I guess your risk to reward in our sense is both the helping and financially to provide for your family is kind of higher end compared to ours. Ours, we have a semi-lower, I mean, we do have high liability because we have the ability to spread radiation, and that is very dangerous. So it does come with like a semi-toxic situation that some people be like, oh, I don't want to do X-ray because of radiation and cancer and this and that. I could see how, in a sense, it could be someone be scared to do it. So, but in a whole sense, if you're still watching, I appreciate y'all. I will give y'all the knowledge always in various aspects, because I don't think anyone in my department or just in my field is doing it. So yeah, it's been your boy Miguel. See you on the next one.